Good morning, good afternoon, and good evening. Welcome to the 907th day of continuous and uninterrupted Zoom session of IFPH. Let us start today's program with a silent prayer for a minute. Thank you. Today, our guest is Dr. Mridul Kumar SAHANI, former President, Curriculum Committee, Central Council of Homeopathy, India. Then chairman and convener of different organizations under the Government of India, winner of various national and international awards, presentation at national and international forums with 45 years experience. The topic is diabetes, the imbalance of sweetness in life, approach in homeopathy. An important topic, a lot of persons are suffering from diabetes mellitus, and the medical world is struggling to give a solution to this problem, this vexing problem. It affects almost all sectors or stratas of this population, including the children. So on behalf of IFPH, welcome Dr. Mridul Kumar SAHANI. Unfortunately, our guest is not joined. He is usually joining pretty earlier, but unfortunately our Zoom session opened a bit late. That may be the reason. Dr. Sergi.
Yes, hi.
Yes.
How are you?
Yes, I am fine. What about the situation there in Turkey?
Yeah, thank you so much for asking. It is a very difficult time. We have a lot of problems. We have a lot of people passed away, and we have a lot of traumatic patients, and the others has very sad and disappointed and like this, and feel empties, and we don't do something, and after that we didn't find any happy moment. We didn't I feel that we didn't any joy in my life, just like this.
What about your place? Is it affected or not?
Yes, I listen to what are your question?
What about your place, your area where you are residing?
Yes, I am in the west side of Turkey. I'm in Izmir. Izmir is there is no problem, but all Turkey had like all land. It's important for earthquake.
Yes.
Sometimes 2 years ago in Izmir we lived, but today we have lived. But today the east side of east and east south.
Around 60,000 people were died, isn't it? What is your estimation there? Or the toll rate, the threat?
We didn't have mainly the homeopathic treatment. Why? If you have some patients and some friends, doctors and nurse ask us, and we online and all calling, and after we want to help all of them, and we have some good chance and some good results.
Yes,
with homeopathy.
especially the post-stress traumatic disorders. Yes.
Yes, a lot of post-traumatic syndrome, depressed syndrome, and these days there is a lot of injury and bone break and mainly gangrenous lesion and most things.
Yes. So definitely
and crash syndrome in the kidney disease, and this is a big problem.
Yes. Now, what about the rescue operations? How far it is effective?
It has some problems. This is the winter. There is some problems in the in this weathers, and at the time we didn't reach on the time and the right time, and like this. But thank you so much for the other countries and rescue team come here and help our team For example, India, Pakistan, and in the West countries, Russia, and the others, Germany, England, like this, and Greek. And
Yes.
we thankful all of them.
Yes. Well, these types of incidents would naturally raise questions about this multi-level apartments, multi-level residential system. It's often very disturbing and destructive, very difficult to make some rescue operations. So everybody should think about that, whether it is needed or not.
Yes, yes. I hope we will some good lesson, take good lesson, and later we will do right things. I hope.
Yes. Okay.
Thank you so much.
Anyway, let us hope for best. Definitely, we can survive all these problems.
Thank you so much.
Unfortunately, our guest is not at joint. Hariharan sir, what is your opinion on the management of diabetes as well as your experience is concerned, sir? Please. Hariharan sir, are you there? Because our guest is to join, maybe due to some technical problems. Hariharan sir, are you there?
Okay, I am here. I am here.
Yes.
Okay. See, diabetes. It is a chronic malady. And I am also suffering by diabetes for last, about 35 years. Since 35 years, I am also suffering. But my strong opinion is that we can manage the diabetes. But I am not sure about how to heal it. But we can reduce the hazards of this diabetes, and not that only, and not that by we can reduce the sugar very much, because see, certain patients are suffering by diabetes and they are using the insulin and see medicines and all, but the sugar didn't come lowered. But by homeopathy, along with homeopathic medicine, we can reduce the sugar from the blood. I am sure about it. I am treating it such patients. So it is a metabolic derangement. It is not a disease. It is a metabolic derangement that a lot of reasons by hereditary. There somebody is getting by hereditary. Certain patients are assimilation disorder. Some patients have gastrohepatic origin. Certain patients have gouty symptoms along with the diabetics. There are certain patients have impotency with the diabetics. Certain patients have melancholia, emotion, and all, and they are getting diabetic. Certain patients along with diabetes, motor paralysis, nervous origin diabetics, obesity with the diabetic, with pancreatic origin by diabetic. For these all we have the medicines. So study well the constitution of the patient and give the medicine. Certainly the medicine, the sugar will come down. I'm sure about it. Dr. Manoj.
Yes, that is most important. Whatever way you practice, but the most practicable or scientific thing is stick on to the basics. That means the constitutional medicine. No other medicine can bypass the effectiveness or the possibility of this constitutional medicine, because we all know that these are all the chronic diseases, definitely, and it is often produced by miasms. So definitely the constitutional medicine and the anti-miasmatic medicines will be more instrumental or protective rather than these palliative methods. But what is more important is that, as Dr. said, wisdom, patience, and courage. 3 things are needed. Definitely, we often approach these cases with a bit of prejudice. we just, when the patient comes, we naturally think what type of diabetes, type 1, type 2, is curable or not. So just like that type of prejudice often creating some sort of doubts in the mind of the physician. I think that is the most important thing, that always this evading from being cured condition. That is most important, I think. Sir, what is your opinion?
Okay, you are correct. You are correct. The basic, we must know the basic treatment. That is the constitution only. There is no other alternative. Their mind symptoms are very important. See, continuous grief will cause diabetes.
Yes, sure, sir. Yes, of course.
Of course, it is, see, acid was, that is one of the best medicine for that.
Yes, wonderful medicine, no doubt about that.
Wonderful medicine. Then they see certain patients exactly the lycopodium constitution. Give the medicine, you give the 50 millismol potency.
Yes.
Certainly the sugar will come down. I am sure about it. For that, I am using lycopodium 6X.
6X or 6C?
6C.
Yes, yes. Centesimal scale.
Very good effect. And natraself, one of the best medicine. I am using natraself 12X. I am using continuously for the patients.
Yes.
Surely that, for only the lycopodium patients, only for the lycopodium patients. And by staphysagria, I have reduced the sugar, staphysagria.
Yes.
Indignation and mortification, that is the cause. Indignation and mortification, that is the cause.
Yes, of course, this is the world. Well, everybody has to face a lot of mortification and indignation. That is the most important thing. Yes.
Okay, next is, the grief.
Yes,
One
sir.
of the main.
Sir, just a minute. Dr. Dhanesh is Dr. Dhanesh, what is the latest update? Yes, please.
Actually, what? Please check whether there
Is yet to join, not joined.
not a join, but
No.
sir is finding it very difficult.
Maybe it's a network problem. There's a long reason.
Sir is
Because-
talking to me now through the. Yes, sir. Yes,
Not
I shall
joined.
once again check. I shall once again ask.
Okay.
Sir is telling that sir is already joined.
No. Maybe in the old platform, that may be the number. Please check the meeting ID. That may be the reason. Often what happens is that there is an old platform that is there. The number that is still there, and often somebody is wrongly entering that when the old ID is there. That is all still in operation. That may be the reason. Anyway, Dr. Sergey, what about the condition of diabetes in Turkey and the management, according to your experience, Dr. Sergey?
Yes, I have some experience in diabetes patients. Diabetes is the most important in Turkey. And mainly phosphorus, lycopodium, natrium sulfuricum, and uranium nitricum, and phosphoricum acidum, mainly using this remedy.
Correct.
And sometimes in the organic organotropic therapy, and sometimes the constitutional therapy.
Okay, very correct.
Sometimes the lycopodium at the same time, like this.
Very correct.
Yes.
Good. Very correct. Very clear. Appreciating you. These are
Thank
most
you.
of. Okay. You have the experience.
Thank you so much.
Then
And we learn a lot of things in the IFPH and your the experience. Thank you so much for Indian homeopaths, all of you. Thank you.
Yes, that's it. Now, Dr. Reza, are you there? From Dr. Reza from Iran.
Yes, sir.
Yes, please share your experience or observations.
About-
Yes, yeah.
Sir, in Iran, like Turkey, because we are very, very diabetic patient in my city. Almost 50% of adult person have diabetic patient.
Yes.
And after Corona, we have many diabetic patient in young patient. Okay,
Okay, sir.
and
Yes, sir.
they have.
Justice join, sir. We shall come to you later, sir. Please wait. Dr. Mridul Kumar Sahani, we have already completed the formalities. Once again, welcoming you, sir. You can have now go through the topic, sir. Please.
Okay.
Dr. Rasa will continue later. Okay. Yes, please proceed, sir.
So good evening, friends. So I am glad to be here again, and I hope we are slightly late because of some technical problem now. So I am starting my sharing with you, and
Yes, sir.
today's topic that I have selected is diabetes. Now we all talk about the diabetes, and we say that it is something happening with the sugar. But what I feel about the diabetes, I'm going to share with you all. So diabetes, the imbalance, I say the imbalance, not the balance, not in proper, not in equilibrium. So of the sweetness in the life. It is, mind this word, sweetness is very important for the life. If you have the sweetness, you have the life. So this word is very important. And sweetness of life lies in the usefulness like honey deep into the heart of the clove bloom. Friends, sweets and salt. Celebrations begins with some sweets. There is a beautiful slogan, kuch meetha ho jaye. Kuch meetha ho jaye. And after having salty food in meal, we seek some sweets. This is very, with this message, I am going to talk about the diabetes today. Now, there are the two opposite ends, sweet and the salt, and balance in life is needed to be maintained between the happiness and the sadness. Sometimes we are very happy, we are not sad. Sometimes we are very sad, but we are not happy. So there, and with this, there is an imbalance created. So now let us see. What is the diabetes? Diabetes, I say, it is a thief. It is the robber of sweetness in the life. And diabetes has been acclaimed as a metabolic disorder in which person cannot metabolize sugar in the blood. As the level of blood sugar known as glucose rises, especially over a prolonged period of years, the sugar becomes toxic to a number of systems in the body, including the cardiovascular system. And diabetes is also, I feel that it is fear of fully participating in the life. You are not enjoying the life. You are not having the proper understanding about the life. And there is great need for control and to know things. Deep need for attention and approval is important. And constant craving for love with a belief that you are unworthy or undeserving. Deep-seated guilt, belief you have to struggle to survive, can often lose yourself in relationship. Constant need for sweetness to mask the feeling of weakness, limitations, and belief that there is not enough. So this is very important. How much you are enjoying the life, how much the completeness of the life is there, how much you are fully participating mentally, physically, and spiritually with the life. This is the aspect that needs to be understood when we think about especially about the diabetes. The cell of our body needs glucose to produce energy, and brain's only food is the glucose. And glucose needs to be at certain level for the brain to function normally. After we reach sugar level, normally rises in the blood, triggering to release of a hormone called insulin from cell in the pancreas called beta cell. Insulin knows how to open the door of all our cells in the body, allowing glucose to enter them. As glucose enters the cell, sugar level drops off until we eat again. When we eat, the pancreas automatically produces the right amount of insulin to move glucose from blood into the cell. And in people with the diabetes, this insulin, there is a little or no insulin production is there, or the cell do not respond properly to the insulin that is produced. So there are the various reasons. There are the insulin, but level is low and there are no insulin. Or if the insulin is there, then it is not being properly responded by the cell. And glucose build up the blood, overflows into the urine and passes out of the body in the urine. Thus, the body loses its main source of fuel, even though the blood containing large amount of the glucose. Friends, we have understood about that there are two types of the diabetes. Diabetes, one is regarded as the autoimmune disease, and most common diabetes, which is becoming one of the 95 to 90% of the people with the diabetes are suffering from this type 2. And this is basically because of the old age, obesity, family history, previous history, just so many constraints that you are getting to manage with the managing the balance, that creates the type 2. And when this type 2 becomes overactivated, it acquires the position of the type 1 diabetes, that is autoimmune disorders. Now, predisposing factors for the type 1 diabetes are the genetic factors. A strong coordination in the monogenetic twins suggests a major role for genetic factors. The major histocompatibility complex antigen are thought to be important. Most type 1 patients shows either DR3 or DR4, while the DR2 is thought to be protective against the diabetes. And so it is auto antibody bodies in the type 1 diabetes. So isolate is not presented. And then for the factor 2, type 2 diabetes, there is a prevalence that is your lifestyle. I say basically it is the lifestyle that is important. With the latent autoimmune disease in the adult is thought to compose about 5% of all patients of that. So this is monogenic diabetes. Monogenic diabetes is the term used for a collection of conditions that cause diabetes, now shown as a result from single gene defects. So basically, it is related to our lifestyle disorders. Now, it is now becoming more convinced that there is an intimate and dynamic relationship between what is going on with our feeling and thought and what happens in the body. Mind affects our organ related to the diabetic changes in the body. And in the homeopathic approach of the treatment, patient has to be treated, not his partner. We are not going to treat the pancreas. We are not going to treat the system or the tissue. We are going to treat with the patient. And when we think about the patient himself, it is not the beta B cells that we have to overlook. We have to go through the life of the patient. So when the regular proper diet control, and even if there may be, you can have a daily routine, but if the happiness is not there, this is not going to create a balance. And the Hippocrates has rightly said, if someone wishes for good health, one must first ask himself if he is ready to do away with the reasons for all his illness. Only then it is possible to help him. So treating a diabetic patient is important, that we must understand that we have to convince the patient, we have to make them apply that you have to change your lifestyle. You have to change the way you have which is causing the problems to you. According to Dr. Henneman, there cannot be, strictly speaking, the local disease of the dynamic changes is never confined to a specific part of the organ, or central to understanding and managing the diabetes. The role of emotional etiology of diabetes has been so the debate. However, personality traits of the patient and configuration. Now, the personality character in diabetes is linked with the symbolic language of pancreas. The pancreas is linked to the solar plexus that deals with the emotions, wishes, and intellectual property. Diabetics are found to be more emotional and harbor many wishes for them and others. They tend to reproach themselves with discontentment or others. They spend much energy fulfilling the inner needs of their emotions, and there is associated inner sadness from unrequired love. Pancreas represents the sweetness of the life. There is another type of the diabetes which begins from the beginning, from the childhood, and this is known as the juvenile diabetes. The probable mental cause for the diabetes are longing for what we might have been, so great desire, the deep sorrow, no sweet. Then your mental attitude, refusing to give, withdrawing, withholding self from others, fear of never being able to have enough, thinking self does not have enough to give, therefore being stinging without one to give. Desire to give and holding back on this, fear of losing from giving attitude of self-righteousness, which is selfishness, conditionally giving and receiving jealousy. Constitutional antibiotic treatment, anti-mimetic treatment, along with the due stress on preventive measures, plays a significant role in the radical cure of patients suffering from diabetes and also preventing long-term complications. There may be the three, we can group the diabetes under the three para, the SORA, psychosis, and the syphilis. This is the primary cause, and this is the dominating factor behind the disease. Then psychosis it is type 2, the insulin resistance, and then so psychotic mad should be present, and syphilitic in the pathogenesis it goes to the DM1, that means diabetes type of the 1. Samuel Hahnemann stated in his chronic disease that diabetes is a zoic manifestation. As per the above knowledge of different pathogenesis, we can consider this statement as prime true on the basic field of SORA. Other psychosis and syphilis can be built up on their own manifestation accordingly. And according to many stalwarts, diabetes belongs to a mixed miasmatic states of SORA and syphilis. There are 7 factors and homeopathic remedies. Genetic defects of beta cells, DNA are the methods, carcinosin, medorinum, tuberculinum, syphilinum. Diabetic mellitus resulting from disease of exocrine, pancreas, arsenical, barita, mure, calcarea, ars, carb, and so many medicines are there. And diabetic resulting from endocrinopathy, barita, carb, carcinosin, pituitary, posterior, ACTH, cortisonum, and several other medicines are there. And drug chemical induced diabetes are also there. So we have the long list of the medicines: agaricus, agnes, cast, arsenical, brynia, camphor, etc. Then infections, carcinosin, medorinum, all the nosodes are there. Then there are gestational diabetes. It includes lactium acidium, helonius, sulfur, and immune mediated diabetes, DNA, nosodes, other nosodes are also there. Now, evolving the therapeutic index of the remedy, reportage the symptoms related to diabetes, clinical rubrics of diabetes, common symptoms, universal complication of the diabetes, the role of the love in diabetes. A study of the reportization filter, focusing on polycrest remedies, and evaluating the main remedy data, medical and clinical experience, and developing the therapeutic index in order of their importance in the clinical practice and not necessarily on quantity of marks, the filter being used as an extra point more. In the synthesis repertory editions, you will find there are 92 medicines listed under the diabetes and 195 medicines under the diabetes mellitus. And under the other rubrics they are related to it, the sugar, urine chapter, 149 medicines are listed. And there are some therapeutic in the caudinium, when diabetic mellitus start after some nervous exhaustion, and remedies like gunpowder, staphylococcus, and molecule altrifolia are extremely useful for diabetic carbuncle and gangrene. Then like urea pura, ampulosis, cunforia are extremely useful in the diabetic neuropathy. Now, diabetic neuropathy is a common complication of the diabetic, and it appears in the first manifestation of the disease. It is likely to occur in even the mildest case of the diabetes. And antisyphilitic remedies are very important here. Then diabetic neuropathy is an important case of the end-stage renal failure. In one case, Tupram arsenicum responded quickly. He was restored to consciousness, started passing urine, and at least for a few months, dialysis was not needed. Then another important complication is about the diabetic retinopathy. So retinal changes, microvascular retinal changes, hyperglycemia is produced. And the important medicines are carbon, naphthalene are often indicated. Now I will share one of the cases here to let you know how I progressed. There was a lady, 61-year female. She presented with the weakness in general, muscular pain all over the body, tearing pain in the legs, numbness and tingling in the legs while walking and sitting, coldness of extremities, frequent urine and vision blurred. Then associated complaints were pain in the joints, especially knee, sleeplessness after breakfast, desire to remain in bed all the time, and frequent vomiting with indigestions. Then the past history for her cyst in the knee was operated in 1997. Polypus was there in the uterus. Father died from and was depression. Mother was diabetic. She is one brother and two sisters. Married at the age of 24. Husband is a government officer. Now he is retired and he is diabetic. And he has one son and two daughters. She is a retired teacher. Liked working to remain busy, loves, discontented with life situation, easily affected by contradictions, gardening, always hurried, fond of eating, desires fits, aversion for the meat, and fasting aggravate, and flatulence after the eating. I reportized this case with the following rubrics: diabetes mellitus, neurological complaints accompanied, then mind occupations ameliorate, mind censorious, element from contradictions, discontent, diabetes mellitus, then extremities, numbness of the sitting eye. Helonius was the only medicines that covered all the 8 symptoms. You will see that Helonius, this is the Metamedica of Helonius, sadness aggravate on seeing other happiness. So it is a jealousy type of the things are there. And with this, we transmitted this Helonius in 0/1 potency, and on the 13th of the March and 25th of the March, the numbness was much better, and reported on 23rd April that insulin intake was reduced to 10 units only, feeling energetic and numbness tingling is no more, and treatment is continued. So some are the useful way tips for preventing the diabetes are: reduce sedentary lifestyle, care of gums, especially controlled diabetes, lack or too much sleep raises diabetes. Breastfeeding reduces mother's diabetic risk. The mother's stress triggers the diabetes in kids. Reduced waistline lowers the diabetes and heart risk. A spinal cord shrinks in diabetic neuropathy. Hepatitis C linked to type 2 diabetes, and psychotherapy helps control diabetes. Like laughter cuts the blood sugar. The treatment of diabetes mellitus in homeopathy is extremely effective, but people do not come to us in earlier stage, and hence once the pathology is advanced, we cannot cure but only palliate the conditions. So it is the fitness to let the mind unbend on occasion. So with this, I will only have a message for you to be positive, to be happy, and so that to be helped with the so freedom is a state of the mind, and with this, if you have the freedom of the mind, you will not be suffering from the diabetes. So thank you so much.
Yes, thank you, Dr. Kumar Sahani. As is always, you are doing some wonders. Exactly noted about the relevance of these mental aspects in the process of curing the diabetes patients. It's time for discussion. Those who would like to participate can raise your hand by going to the participant list, please. When Hanuman was very, very instrumental in pointing out all these things, the importance of this mental, the calmness and the evenness of life is often pointing out to that. Even though it was there, the most important thing beyond that is the miasms. That is always excessive hardships, laboring in swamps, great bodily injuries and wounds, excess of cold or heat, and even the unsatisfied hunger of poverty and its wholesome food, etc., are not by any means very powerful in causing the fearful malady of Sora, which lies in the ambush. So just like that, the most stressful, difficult thing is secondary. But in containing the diseases with medicine, well, these the advice given by Brother Sahani sir will definitely act. Dr. Rasa from Iran, raise the hand. Dr. Rasa, yes, please continue.
Hello, sir. Thank you, Dr. Sahani. That was very, very useful. I have two questions. First, I have a case. She had the bleeding in the eye. She is diabetic and had bleeding in the eye. The bleeding was better by arnica or other and cortalis horridus, but a spot remained, not dissolved. Spot curtain like and not dissolved. Which remedy do you recommend it? And for neuropathy, which remedy do you said in your session? I can't hear that. Thank you, sir.
Thank you, Dr. Reza. But it is difficult for me to prescribe the medicines on the symptoms that you have spoke, because we are not getting the complete constitutional factor. You have to go to the complete history of the patient, and then only we can make some suggestions. And we must have an interaction, because I have to see the mind, I have seen the physical state and the life situations. This is very important for any of the case to come. There is the therapeutic approach are very misnomer for the diabetes therapy. It is only the diabetic. It is only the constitutional way that will help you to arrive at the and help the patient with the right medicines.
Thank you, sir.
Yes, I think you can contact Brother Sahani sir, is the most experienced physician in India, through our telephone or email. So definitely will give you an idea or what to do. Yes. Okay, sir, am I right, sir? Brother sir. Brother Kumar Sahani, sir.
Yes, sir.
Yes, Dr. Rasa will contact you, sir. Okay. Yes, Dr. Hariharan, sir, please, you can proceed, sir. Yeah. Please unmute, sir. Yeah. Yes.
Okay, Dr. Sahani, Your class is fine, very fine. What you said are very correct. Constitutional approach is the best approach, no doubt in that. So what you said is the patients are not coming at the initial stage. See, after complication starts, they come to us and see, consult with us. See, doctor, I have diabetic neuropathy, diabetic retinopathy. These are all. See, one of my doubt is that, have you got any experience with the thyroid for obesity cases in diabetics? Certainly, I know that by constitutional methods only it will be corrected. But any experience you have regarding this thyroid, doctor?
Thank you, Dr. Hariharan. Thyroidinum, if you think specifically, then I will say no, because I don't go like that. I go to the life history complete, and then any medicine, thyroidinum can be covered under the totality, and that we have to follow the art of repertorizations, where you can include. People say that with the repertorizations you only get some of the common medicines, but I don't believe this, because even might have seen in the case that I got the Helonius. Helonius is not thought of in the diabetes case, but I did it, and I got the medicines only through the constitutional understanding. So this is very important. Thyroidinum may be indicated. There are the importance, because thyroidinum has got the great role on the maintaining the hormone of the body. This is important, but it is important, first important, how much it is affecting the patient, the constitution, how much the entire constitution is affected is very much important.
Doctor, another doubt is that, see, usually I am using the constitutional medicine for diabetes is at lower potency. And that also I am getting, if it is acid force, if it is lycopodium, if it is phosphorus, I am using, these are all lower potencies. Which for potency selection, what is your opinion for constitutional medicine?
When you look at the diabetes concept that I have given to you today, that imbalance of the sweetness in the mind. Basically, diabetes is maintained in the body, in our life, only because of our mental attitude. So if you are able to understand the mental attitude properly about the patients, his discontentment, his contradictions, his irritability, everything, then you can start with the higher potency. You can go up, because when the mind is very important, so it becomes more sensitive, because the law of the potency prescribing is higher the sensitivity, higher the potency. Higher the sensitivity, higher the potency, and lower the sensitivity, like the pathology. If you are thinking is based on the pathological aspect of the diabetes, then you can go think about the lower potency. But we have to think about the higher aspect of the diabetes, because diabetes is not that pathological reports are based on the something which is on the ground level. But where is the ruler? Which one is the guiding factor for that? That has, if you consider that, with there you will require the higher potency.
Higher potency means which potency you mean?
Usually I am prescribing the LM potency. So higher potency, I go beyond 0/7 to 0/10.
Okay, thank you, sir. Thank you, sir. I will try.
Yes. Okay. Now, Geeta madam. Madam, please unmute. Yes, madam.
Sir, thank you very much for this much information. And sir, please, can you share your experiences in treating juvenile diabetes?
Yeah. There are few cases that came to me, and I was wondering that whether this child is suffering from the diabetes. but the sugar level was very high, and it was only about 18 or 18, 17, 18 years age boy was there. And with this way, I considered he was very much, his desire was very, what you can say, capriciousness. This was very important for his life because he always wants this, that, this, that. So he was very much demanding. It may be the life situations he might have developed. And taking this rubrics, capriciousness and other conditions, I got a very good results in the juvenile diabetes.
Okay, can I suggest one thing?
Yes, sir.
Dr.
Yes.
Manoj, can I
Yes, sir.
suggest
Sir?
for
Yes,
juvenile
sir.
diabetes? See, for juvenile diabetes, take the case of mother very correctly.
That is
Then
also
find
true,
out
sir.
find
That
out
is
the
also
ma-
true, sir.
is
Yeah,
it correct?
That is also true, sir.
Okay,
You
that
are-
is
you are very much correct.
correct.
You are
That-
very much correct.
Thank you, sir. Thank you, sir. Thank you, sir. That is
Okay.
my opinion.
No, I usually when a child comes or any even if the adult, I go to the parents. I ask them. I talk because it is not only the child. We also are affected by the child because our father and mother, they have made our mind. They have made our life. So
Okay.
they are the architect. So until you see how they have been made, you can understand the person in a full way.
Yes, sir. Of course.
Very
Past,
correct.
yes, past supplies key to present. Of course, sir. Yes.
Okay.
Thank you, Gita madam, for your nice question. Now, Dr.
Sir, one more question.
Yes,
Sir,
yes, please.
the effects of gestational diabetes can affect the baby, and can we correct it, sir?
Definitely, madam.
Effect
Definitely.
of gestational diabetes.
Yeah. Gestational, you have to go to the pregnancy history.
Okay.
And even before the pregnancy, this is very important in the gestational diabetes because pregnancy history, most of the pregnant lady, they have the long, very bad history during the pregnancy. This can give you a very better rubrics for the treating the gestational diabetes.
Thank you, sir.
Okay.
Thank you.
Yes, madam. Now, Dr. Rasa, please unmute yourself. Rasa, you can ask.
Excuse me, sir. I want to share something that in Iran, there are many diabetic patients that got cured by a complicated patient that cured by raw vegetarianism. They eat only raw vegetarian fruit, vegetarian, something like that, and they got cured in the complicated diabetic. I saw them.
Yes.
I want to share this.
Raw vegetables, isn't it?
Yes.
Dr. Reza, I'm very much convinced nowadays that diabetes is not related to the food habits. Yes, food habits have some contribution, but what you are eating, according to your choice, if your desire is fulfilled, then it is not going to cause you. So even with the patient who have a strong craving for the sweets, I allow them to take the sweets. I allow them to take the sweets. I allow them whatever they like, what is the strongest craving for them, because this will help them to maintain their emotions, control, satisfy their contentment will be there. So this contentment will act as a remedial measure for the patients. So don't feel that this thing is going to affect the diabetes, this thing is going to affect the diabetes. No, if you think like that, then everything has got the positive, will become the positive factor for the diabetes, and everything will become the neutral factors for the diabetes.
Thank you, sir.
Thank you.
Yes. There is a question in the chat box, sir. There is, sir, can you please give the explanation for why all ideal rubrics are categorized as civilistic, like conscientious, fastidious, religious, honest, etc., artistic, passionate? Why
Can you
all these
repeat the
are?
question, sir?
Give an explanation for why all ideal rubrics are categorized as syphilitic, like conscientious, fastidious, religious, honesty, etc. Yes, artistic, passionate.
Categorization, this is different topic. Categorizations of the rubrics, it depends on the individual of the patient. Where to apply, which rubrics is dominating in that patient? Which rubrics is dominating in that patient? This is it is not that we are using the fastidious, we are using the, because fastidious. Now, what you think about the fastidious? Fastidious about what? Now we can't say it is only about the dressing and the placing of the thing. The stiffness of the mind, fastidious, not to be convinced that he's fastidious about the for the eating, he's fastidious about the time, he's fastidious, and on that categorization, now the new rubrics are also coming up. So the big rubrics, they are the large rubrics. Fastidious has become a very large rubric. Conscientious about trifle has become a large rubric. But among that, you have to come to the sub-rubrics. Sub-rubrics are more important than the large rubrics. And if you are able to find a sub-rubrics in the patient, you are getting a better, you are nearing to the more simillimum of the patients.
Okay, Hariharan sir, yes, in 1 minute. Please unmute, sir. You are muted, please unmute. Yeah.
We are not able to listen to you, Dr. Hariharan.
Okay.
Yeah.
Can you hear me, doctor?
Yeah, now we can hear you.
See, it is only an, sir, it is only an opinion towards this Dr. Rasa, that I have also seen the patients who are taking the vegetables only. They come to the sugar is coming down as normal. But when they change their life habits, it will again go up. That means it is not a curing phase, but only for the time being that the sugar will come down. When they changes their food habits, it will go up. So it is not curing, but only temporary means. I like to say like that, because I have seen a lot of patients like that here. That's naturopathy. They are using naturopathic diets.
Okay, sir. Time to wind up. May I invite Dr. Thanesh to have his opinion as well as a lot of thanks. Dr. Thanesh, please. Please unmute, Dr. Thanesh.
Yeah, good evening all, and good evening, Kumar sir. Really a very good presentation, even though there was some a little problem in the beginning due to some technical failure, because it was a mistake on my part by posting a wrong link on the head of the poster. That was a big mistake, because I just changed my phone some 2 weeks back, and the link I got was from secretary was just a wrong. And that's the reason everything happened. Sorry for the mistake. I beg a pardon for that, for those who are suffered from this. And anyway, this subject is a wider one, and there was a beautiful discussion going on, and I heard everything of the speech, and really it is a thrilling game. I just got a case today, which was having diabetes, HbA1c 12.2. And she was taking medicines from allopathy side. Then actually, this is the first time they are coming for homeopathy. Then what can be the method? Frankly, simply I have to give some tincture for that, because the constitution won't work, just like as you told just now, that because the intensity of the disease is a big pathological condition, and because of that I have to go with this medicine. Anyway, I'm not elaborating anything on that. What is your opinion on that? Then I shall come up for a lot of thanks, sir.
Time is yes, Dr. Thanesh.
Yes, sir. SAHANI sir, can you respond?
Yeah, I'm able to listen to you.
Yes,
no,
sir.
no, Dr. Thanesh, please conclude, Doctor.
Yes, sir. With that, we come to the end of the session. I am very happy to say thank to Dr. Nipil Kumar Sahani sir, because sir is always ready to share his knowledge without any problem. The only problem was our problem. And anyway, we are all thankful to you, sir, because at this age you are giving homeopathy in a very good contribution from your part to promote homeopathy, as the aim of our Zoom is also to promote homeopathy among people. And thank you very much, sir. Once again, hope that you will come up with some more presentation in the future. I am thankful to you on behalf of myself as well as on behalf of International for promoting homeopathy, sir. Thank you very much, sir.
Well, that's why Gita said 3:17, Atma Truptascha Manava, you rejoiced in and is satisfied. That is most important. That rejoice is more important. The satisfaction. Nice presentation. With that, let me conclude today's session. Hope you to meet the same day tomorrow. Till then, goodbye. And it's all Dr. Sanesh for continuation program in Malayalam.